Hi, I'm Dr. Frank Watson with Fit Chiropractic and Acupuncture, and I have a patient here today that has chronic lower back pain that refers and kind of rotates across the hip. Also a little bit of pressure into the knee. And so what we're going to do is, instead of just adjusting us through the SI joint and through the lower back, we're going to actually work on that fascia. So we're going to do some dry needling today. And a couple of different things that I wanted to point out. So if you have back pain that radiates into the hip, most likely you'll also have some knee sensitivity through here or into the abductors, okay? So we can either work on these each individual treatments, or we can do it all as one. And so what we're gonna do is we're gonna do it all as one today. And so you're gonna see a little bit of classical for dry needling. So when we talk about knee, so what we're gonna do is we're gonna come up, we're gonna find that what they call the vastus medialis oblique. So this is a muscle that kind of comes right up through here. It's part of the quad, so it's one of the muscles of the four quads. Okay, so when we do a little bit of a dry needle, see how we got a little twitch response? So the whole muscle kind of moved. So now we have a full dry needle for that PMO. Okay, so when we're doing a twitch response like that, we don't need to leave that muscle in, or we can't leave it in if we're having chronic pain. But how's that feeling? Loosen up.
Yes, loosen up.
Yeah. All right. So are we still tight into the hip flexor?
A little
A little bit. Okay. So now we're going to do a hip flexor reduction one. So when we're doing the hip flexor, okay, we have a couple different things we want to look after, but most of these patients will get sensitivity kind of right along the base through here inside the hip. So when we're doing a hip flexor reduction, any sensitivity there?
Yep. Right there.
Yep. And so now that muscle is nice and loose. Any sensitivity there? Okay. Now I'm going to go back and touch some of those points that were hurting before. Any sensitivity there? Any sensitivity there?
A little bit, but
So a little bit into the abductor.
it feels like it's coming.
Okay. And then what about on the outside here?
A little sensitivity.
A little sensitivity right there into that? Okay. All right, so what we're gonna do is, instead of adding a secondary needle, what we're gonna do is we're gonna add a little pressure. And so I'm gonna use a manual technique that will also help relax that hip flexor. Nice deep breath for me. And then breathe out. I'm just gonna rotate. Relax. Take a nice deep breath again. So we reduce the hip flexor, reduce the VMO, which allows this hip to rotate. So when we go in to make the adjustment for the lower back, now all three conditions of the lower back, the anterior hip, and the knee wall. Okay, thanks for joining us.